Reforming police, racism as a health crisis, and Dr. Acton steps aside. Joining us on Columbus on the Record this week, Joe Ingles, State House reporter for Ohio Public Radio, Dale Butland, Democratic strategist, and Clarence Mingo, former Franklin County auditor. The debate over police behavior and officers' relationship with people of color is moving from the streets to meeting rooms to the halls of Congress and to the State House. As the protests continue, just about every political leader says we must do something to heal the divide between police and African Americans. But what to do, how far to go, and how fast to do it has a range of opinions as wide as the divide between the protesters and the officers. Solutions range from calls for more officer training all the way to abolishing the police. Dale Butland, on the far left, there are calls to abolish the police. That's the extreme on one side. On the other side, basically, is steady as we go, maybe more training, a better system to weed out bad officers. Where is the solution in your mind?
Well, so first off, let me just say that police using excessive force against black folks is not exactly something new. What was different this time is that the entire nation watched a white police officer kneel for nearly 9 excruciating minutes on the neck of George Floyd, and actually saw an unarmed, compliant black man being murdered on national television. So now, for the first time, a majority of white Americans, according to polls, support major change, which is why this time it might actually happen. But this time, I would say, it can't be incremental, tinker around the edges kind of reform. This time, it's got to be something major. But at the same time, you touched on this, Mike, words matter. And people have to be careful. People who do want change have to be careful about using words like defund the police, which can be so easily twisted and manipulated by people who want to keep the status quo. Nobody wants to call 911 in some sort of emergency and have nobody answer the phone, which is why neither Joe Biden or anybody else in a position of national authority is talking about zeroing out police budgets or getting rid of all law enforcement officers. What we're talking about is reforming our policies governing police use of deadly force, the way they interact with communities of color, and maybe modifying things like the so-called qualified immunity laws, which don't allow police to be held accountable for criminal misconduct or violating the civil or constitutional rights of our citizens.
Clarence, we talk about defunding the police, and I think only the far, far extreme wants to zero out funding. I mean, when they say defund the police, they mean reduce funding for the police, or take some of the money for police and spend it on other areas. We looked at the City of Columbus's budget. The City of Columbus spends $360 million on police. That's 39% of the city's budget. The city spends more on police vehicles than it does on affordable housing programs. The amount of money it spends on police uniforms is 3 times the amount of money the city spends on its program to reduce infant mortality. Does the City of Columbus and other cities, do they spend too much money on police? Clarence.
Yeah, I think, Mike, it certainly is time to revisit financially how taxpayer dollars are spent relative to law enforcement. Part of the concept of social justice is economics. When we spend more money on law enforcement than we do on the right, not the privilege, but the right to affordable housing, that's a problem. It's a problem in America, and it's a problem right here in Central Ohio. I think we have to be thoughtful about the influence of unions on our elected officials and how that can be a limiting feature of the decisions that need to be made as we look at law enforcement budgets and how taxpayer dollars should be spent to ensure that those budgets reflect the times, the need, and any measures of reform that are needed. Given what we've experienced the last 3 weeks in the United States of America, given the video with respect to George Floyd, there is no doubt on the right or on the left that the training dollars need to go up. The fruit of that training needs to be experienced by the taxpayers, and then other measures of reform need to be examined. But now certainly is the opportune time to do it.
Joe Ingles, policing is a local matter. Most police officers work for the city or the county or the township where they're employed. But state officials, state government has a role here. They of course, they pass state laws. They help fund local police agencies and, of course, state highway patrol. What is going on at the State House? What are they calling for as far as an overhaul or reform changes to policing?
Well, it depends on who you talk to. There's a lot of different ideas that have been floating around here. One thing, though, to point to is back in 2015, there was a panel that was put in place by Governor Kasich, then Governor Kasich, that looked at community policing. That panel, the working group, what it came out with, those outcomes have not been fully funded. So there are a lot of people, mainly Democrats actually, that are saying, let's fund that. Let's make sure that gets put in place. You've also got a lot of the lawmakers on both sides of the aisle are saying, training is a good thing. That maybe even there's a 15-point plan out there that was put forth by a Republican lawmaker, and a lot of House members support it, that say, let's look at the policing, let's look at working groups to try to look at what we can do to make this better. Let's go ahead and get some more instructors, that can deal with this better at the police academy rather than the instructors they've had. Let's have different instructors. And basically, the thought is from a lot of the lawmakers that they want to try to look at policing through a lens of, how this affects the overall community and the Black community. And I think that's what we're going to see from lawmakers, but how they proceed with this is going to be controversial because a lot of people want different things.
Yeah. When I look at this debate, I look at it, when you hear about the gun debate, whenever you have a mass shooting, the folks who are opposed to gun control, gun regulation, say it's mental health. It seems when we have these police incidents that are caught on tape, the gut reaction for folks who want few changes to policing point to training. We need more training. Clarence, is it more than just training? Is there a culture thing here that has to change as well?
Yeah, that's the word I was going to use in response to your question, Mike. This absolutely is an issue of culture, and I think the average citizen finds themselves in a bit of a conundrum because on one side, we do appreciate law enforcement and we do applaud the sacrifice being made. The other side of it is there is a reluctance by Republicans and Democrats and even members of the general public to say anything long-term that might be too indicting or too hard with respect to law enforcement. And what we see now is that there are systemic realities in law enforcement that are not good, that are hard upon African Americans. And so we now have to honestly say, yep, training is very important, but now there is a culture with respect to temperament. There is a culture with respect to character that has to be examined and made higher within the ranks of law enforcement. And it's okay to say that. It's okay to say that law enforcement at this hour, in many instances, is a troubled institution in the United States of America. It's a necessary institution, but it has to be right because of the role they play in our society. So the culture has to change. I think it starts with temperament and character.
Dale, these changes will take time. The Columbus Police contract is due up at the end of this calendar year. But things could be done right now. The city of Columbus could say no more tear gas. It could say no more chokeholds. The state could do that. Is that something that officials should do right now in the near term while we work out the training and the culture changes?
Well,
yes.
Let's let
I'm
Dale
sorry.
talk. Go ahead, Dale.
Yeah, the answer is, Mike, yes. But I also think, and this kind of builds on something Clarence said, I think in some ways we're also asking our police to do too much. And as we begin this process of sort of reimagining ways to keep us safe that maybe don't rely quite so heavily on law enforcement, I mean, one of the things we need to start talking about is whether issues like, let's say, domestic violence or mental illness, homelessness, wouldn't those things be better handled by, say, social workers and other police professionals instead of asking cops to resolve these issues that they're neither trained for nor equipped to deal with.
Yeah, like we ask a lot of teachers as well. We ask a lot of police officers and
Right.
more stuff. Speaking of that, after local officials in Central Ohio declared racism a public health crisis, state lawmakers this week took up the issue. A Senate committee held a hearing and heard testimony of how African Americans face shorter life expectancies and disproportionate amounts of health issues when compared to white Americans. Then, Senator Steve Huffman of the Dayton area asked a startling question.
Could it just be that African Americans or the colored population do not wash their hands as well as other groups, or wear masks, or do not socially distance themselves? That just be the explanation of why the incident?
Steve Huffman's question drew immediate criticism and calls for his resignation. He lost his job as an emergency room doctor. Clarence Mingo, should Steve Huffman lose his Senate seat? Should he have to resign?
Well, I think the members of the Senate are going to have to decide that question ultimately, and more importantly, they're going to have to understand where the public is at on, what played out in the impact of his words at this particular time in history. I can tell you it was a serious moment and did not reflect well on the Republican Party, the Ohio Senate, and the patience that taxpayers and voters are being asked to demonstrate during this time is really being stretched. But ultimately, this is what's at issue. Number one, Senator Huffman's comments indicate that we are not even in a position to begin conversing about racism. We don't yet have the tools. We don't yet have the acumen. And sad to say, we don't yet have the level of education needed one to another to even begin addressing these issues in a governmental forum like the Ohio Senate. And that tells you something. It certainly speaks to why people are so impatient, why people are so angry right now, despite America's long, very poor story with respect to civil rights and race relations. It just cannot be the case. And it's a very sad reality that we don't even have the ability to be conversant. The other thing we have to think about, and I'm very mindful of this with respect to Senator Huffman, is that there will be people, perhaps in large numbers as we go through this transformation of culture, who will be making comments and sharing their thoughts about race relations and racial equality. And there will be times when they will do so in a way that is inartful. There will be times when they do so that's simply inappropriate. In either case, we have to begin thinking about a path to rehabilitate these individuals. What we don't want to do is permanently exile them or bar them from the conversation or from the general population. We want these people ultimately to become examples of change. We want these people to become examples of what education, enhanced understanding, and contrition can be in the lives of people who make these mistakes and who vow to do better. So it has to be dealt with. There are consequences for what Senator Huffman says, no doubt about it. That aside, for everyone else, to include Senator Huffman, how do we begin rehabilitating and bringing these individuals back to the table, the community table, for dialogue and modeling them as an example of transformation, hope, and positive change about what America should be? That conversation is needed as well.
Yeah, Dale, this kind of reminds me of Governor Northam in Virginia. He had the picture. He was in blackface when he was in college. He didn't resign. He stayed there, and the controversy has subsided. Senator Huffman apologized, said this was awkward. He didn't mean it. Do we take it that this was just a bad choice of words, or is there something deeper there? Dale, what do you think?
Well, I think what was incredible is that this statement was made at a hearing about whether racism is a public health challenge. And to me, what was most stunning wasn't Senator Huffman's reference to colored people. I mean, that's a 1950s term, but in fairness, that's where a lot of Republicans would like to live. But what was utterly breathtaking to me was that in the year 2020, an emergency room doctor would actually ask whether black folks get the virus at higher rates because they don't wash their hands as often as white people do. I just think it is stunning. This is not something that happened or he said when he was 19 years old. This was this week. And the good news for him, I suppose, is that he's now going to have a lot more time to spend on his own personal hygiene since he lost his job as a doctor.
Joe, what's the feeling at the State House? Are Republicans rallying around him? Are they just trying to distance themselves from him? I know Democrats issued a statement today, but they didn't call for his resignation. They called for deeper understanding, more work to heal the divide, but they didn't call for his resignation.
Well, what Republicans aren't either. I mean, they're not calling for his resignation either. I think, we haven't heard a whole lot of Republicans speaking out about this, although we have heard some Republicans who have made some contentious remarks themselves. He's not alone. I mean, there are other remarks that have been made at the State House by white Republicans and even, just operatives and people that are at the State House every day. I think that what this really draws attention to is that we have a whole lot of people who possibly aren't around, their groups are not diverse enough. If you have a lot of Black friends, Black family members, and you have less of an echo chamber and more of a diverse group around you, you are more likely to understand just everyday issues and everyday things in different ways. And I think that's one thing that we hear people starting to say is, hey, we need to really think about this from a different point of view, from a different lens. And remember that we're not all the same. We don't all look at the same situation the same way. And we've got to start looking at things differently.
All right. The woman who has been the face of Ohio's struggle against the coronavirus has suddenly stepped aside. Dr. Amy Acton drew wide praise for her empathetic, clear descriptions of the danger posed by COVID-19 as she and the governor closed down much of the state to slow down the virus's spread. The director of public health also faced loud criticism from conservatives. She heard calls for her resignation at protests at the State House and at her home. House Republicans have been working to restrict her power. She alluded to that criticism as she announced her resignation.
I didn't run for election, and this is a new world to me. And so any human being, of course, this was new for me. But I have to say, for anyone doing this job, you'd be surprised how much a lot of that isn't your focus. I mean, for me, my focus, the need to protect Ohioans and save lives was so intense, especially during this first phase. I can honestly say it had to be a single point meditation on the task at hand, and it remains that.
Joe Ingles, Dr. Acton was kind of vague in her answer as to why she was leaving now. She mentioned that she was doing 3 different jobs. She mentioned the pressure from outside things. And was it that? Was it something else? Was there any idea of a conflict with the governor and how things were going? Do we know for sure why she's leaving now?
Well, I think, we don't know for sure. We know what she said, and that's what we know at this point. But I think for any person in her situation, if you're a medical doctor, you're looking at what's happening and you're looking to save lives. You're putting life and physical well-being above all other things. Dr. Acton was dealing with a lot of people who were putting livelihoods above everything, all other things. And there was a dynamic there that was just really difficult. And it would be difficult for someone, especially someone who's not used to that, to deal with that. So I think, we've seen it in other areas of the country where health leaders have been stepping down. They've been ousted. They've received threats. Dr. Acton is certainly not alone. We've seen it in California and Colorado and other places. And I think that's, something that you're going to get into, because when you look at things as politics, it's different than when you look at it as medical advice or a medical situation. And she's caught a lot of grief for looking at it the way that a doctor would look at it.
Yeah, Dale, let me ask you, as a longtime political communications expert, the way this was played out is she became the star right away because Governor DeWine put her right front and center, and she drew a lot of praise for the way she handled this, the way she explained it, telling us, look at Italy, we can't become Italy. She was out front, but as a result, this person who's not a politician, not a political figure, became the lightning rod. In hindsight, was that the right move by the governor to put her out front?
Yeah. Yes, it was. And I think the country would have been a lot better off had President Trump put the experts out front at his briefings every day. I actually, Mike, spoke this morning to a reporter for a major Ohio news outlet who has spoken to all the relevant parties involved. And I can tell you that according to him, that while there were several reasons behind Dr. Acton's resignation, including personal and family considerations, one of the key reasons that we've lost this incredible public servant are the vicious personal attacks that she has endured for weeks now from mindless right-wing knuckle draggers like Representative Nino Vitale and others in his merry band of neo-fascists. This lady, Dr. Acton, has actually had armed protesters show up at her home in Bexley. She's had to have a security detail because of death threats that she's received that law enforcement have deemed credible. That's where we are in this country now, Mike. We have a viral pandemic that has become just another piece of the culture war in which a governor and a dedicated doctor and state health director trying to save lives and keep us safe are being cast as tyrants who are trying to take away our liberties. It is appalling.
Clarence, it really is an example of how the volume is just on 11 right now when a doctor, a physician, a public health official becomes the target. These were Governor DeWine's orders. Let's face it. She didn't go rogue here and shut down bars and restaurants in the middle of March. That was Governor DeWine's order. She put her name on it because she had to legally. But what do you make of Dale's comments and the attack she faced?
Yeah, well, I could not concur more with Dale's thoughts. I think we all should be grateful and very appreciative of the service rendered by Dr. Acton and Governor DeWine. It was a shameful moment for Republican legislators and operatives to condemn her, intimidate her, and otherwise thwart what was a very difficult yet masterful effort to save, protect the lives of Ohioans. And I found myself, at the height of the crisis, just a tad angry because many of my fellow Republicans who would just tear into Amy Acton would say absolutely nothing about the often foolish and then sometimes comical and certainly less than capable behavior of President Trump during this pandemic. On one hand, we have a physician who was very thoughtful, well-informed, executing procedures approved by the CDC and recommended by the CDC. And opposite of that was the president, who was very self-absorbed, focused on the politics, and it is not clear that he was truly concerned about the welfare of the average American during this pandemic. So this was one of those moments that, again, the GOP should be ashamed. My brethren who are Republicans should be ashamed for our treatment of Amy Acton. Even if we disagree with the policies, there is a better way, a more respectful way, a more artful way, if you will, to express that measure of disagreement. What went down this past spring, insofar as Republicans are concerned, maybe Democrats did the same thing, but speaking in terms of Republicans, shameful, simply shameful.
And Joe Ingles, just really quickly, 30 seconds left, the fact that Dr. Acton is a woman, that was raised up by certainly the minority leader in the House, pointed that out.
Yeah, and that's, we see that women tend to take the brunt of this more. It's the way it is. It plays out. Look at governors or any woman in a position of power. It seems like they do get targeted a little bit more for some reason.
All right, let's get to our off-the-record final thoughts, some predictions, parting shots by our panel. We'll start with you, Dale Butlin. You're up first.
Well, with just over 4 months to go, President Trump is in deep doo-doo. Joe Biden is beating him nationally in every swing state, and even in places like Ohio and Florida that Trump won the last time. A new Gallup poll this week shows the president's job approval rating stands at just 39%. If these trends continue, a blue tidal wave in November could give Democrats not just the presidency, but the House and Senate too.
Clarence Mingo, your final thought for this week.
You know, this week, past 2 weeks at least, we've seen ranking members of the United States military and other notables in Republican circles break rank with the president on issues of significance. We've seen Republicans show contrition and step back from poor choices. My thinking is that that's going to continue. My hope is that Republicans continue to sober up, distance themselves from this Republican president, and demonstrate to the American people that better days are ahead and they can expect better from our leadership.
And Joe Ingles.
I want to say a personal thank you to all of the artists out there who have worked painting up these boards, these ply boards that have been put up at all these businesses. We have seen, something that was really ugly made into beautiful works of art. And I think that I'm hoping that somehow we can use this as a learning tool. I think it would be fantastic if there was a way that this could be put for future generations to really tell the story and make it visual so that people understand what's been going on. And thank you.
And if we name any more task forces to study the pandemic or race, we're going to need a task force to monitor the task forces. That's Columbus on the Record for this week. Check us out online. I'm Mike Thompson. Have a good week.